This is The Good, the Bad, and the Ugly, a case report on Stevens-Johnson syndrome by Aysha Shafi. The case history. We had a 74-year-old white female present for a scleral lens follow-up. Her medical history was significant for Stevens-Johnson syndrome, diabetes mellitus with renal complications, rosacea, asthma, and anxiety. Ocular exam showed trichiasis, matarosis, symblepharon, corneal neovascularization, corneal scarring and thinning, history of dysmetacyle in the left eye, and vision entering was 20/40 with a scleral in the right eye, and count fingers at 3 feet with no lens in the left eye. So what is Stevens-Johnson syndrome? Stevens-Johnson syndrome is a serious adverse drug reaction, mainly involving the skin and mucous membranes. It's a potentially fatal hypersensitivity reaction that can have many systemic manifestations, including in eyes, mouth, the gastrointestinal tract, and lungs. The most common long-term complications of Stevens-Johnson syndrome are ocular, including blindness, cutaneous, and renal. Mucosal involvement with blisters and erosions can lead to strictures and scarring. Immediate management includes stopping the suspected causative drug, hospital admission, fluid replacement, temperature control, and supplemental oxygen. Medications are causative in over 80% of cases and can affect anyone with a genetic predisposition. A person of any age, either sex, and all races can be affected, although it is more common in older people and in women. It's more likely to occur in people infected with HIV as well. Listed are some drugs that have associations with Stevens-Johnson, but this is not a full comprehensive list. Our patient's timeline. In 2014, she developed Stevens-Johnson syndrome after a new blood pressure medication was started. Her VA dropped to 250 and left eye was 2100. In 2021, she was fitted with scleral lenses and her VA improved to 2060 in both eyes. Unfortunately, in 2022, she developed a dysmetacyle in the left eye. Her vision decreased to light perception in the left eye, at which point cornea decided to pursue aggressive topical steroid use until her left eye stabilized with count fingers vision. Unfortunately, again in 2023, she developed a conjunctivitis with the left eye and her vision decreased to hand motion. Important to note that she showed to cornea with these symptoms, so this vision was hand motion without the lens in. But again, this vision measured was less than her previous uncorrected vision in her left eye. Here's an image of a dysmetacyle. This is not our patient's image, but you can see it's a herniation of Descemet's membrane. Treatment of a dysmetacyle will depend on the underlying disease in addition to the size, extent of stromal involvement, location, and visual potential. Dysmetacyles may result from traumatic, infectious, or inflammatory conditions. Due to the stable appearance on our patient, therapeutic scleral lens wear was continued during this time to protect the cornea from ulceration. When we saw the patient next, her keratoconjunctivitis had resolved and the dysmetacyle had significantly improved. She was also approved by cornea to continue with scleral contact lens wear. Her vision had improved from hand motion, again without the lens, down to 20/80 with the lens. Here's some other images of her eye. You can see the matted, scarred appearance with corneal neovascularization on the eyes. In this video, you can see the fit of the scleral lenses on the eyes. In conditions like Stevens-Johnson, where the ocular surface is at high risk for dryness, desiccation, and scarring, we can fit larger diameter lenses to cover more surface area. Ensuring we have enough of a tear reservoir to provide a liquid bandage, but not too much to cause suction issues, is a balance we achieve as well. Therapeutic applications of scleral lenses. Scleral lenses vault the entire cornea. This allows for a stable tear reservoir, protection from desiccation, protection from shearing forces from the lids, continuous corneal hydration, and promote reepithelialization. This provides relief or resolution of dryness, pain, irritation, and photophobia when wearing the lenses, and allows for more stable vision. Some clinical pearls. In patients with Stevens-Johnson syndrome, regular follow-ups are essential to evaluate for progressive corneal scarring. Scleral therapeutic lenses are of utmost significance for ocular surface protection, comfort, and vision. Professional collaboration is key in a systemic condition with extensive system-wide manifestations, such as in Stevens-Johnson syndrome. Thank you.